Investigating fatigue, which tests help and which don't. One of the first questions patients ask when they experience persistent fatigue is, Doctor, which test should I get done? While investigations are important, the answer isn't always more tests. It's about ordering the right test for the right patient. I'm Dr. Ashwitha Shruti Das, consultant physician and diabetologist in Manipal Hospital, Old Airport Road, Bangalore, and I also work as a diabetologist in SugarFit. So, evaluating fatigue requires a thoughtful clinical approach because not every patient needs the same investigation. The first step is in ordering a long list of blood tests. It begins with understanding the patient's symptoms. We ask how long was the fatigue been present? Is it affecting daily activities? Is it associated with weight changes, poor sleep, fever, or other symptoms? The patient's history often provides the most valuable clues. Based on the clinical picture, we may recommend investigations such as complete blood count to look for anemia, blood glucose or HbA1c to evaluate diabetes, thyroid function tests, vitamin B12 and vitamin D when the patient is having all the symptoms, kidney and liver function tests, inflammatory markers, or other targeted investigations when appropriate. These tests help us identify the common medical conditions that may contribute to persistent fatigue. At the same time, it's important to remember that more testing doesn't always mean better answers. So, ordering multiple investigation without a clear clinical reason can lead to unnecessary anxiety, additional costs, and sometimes confusing results. The goal is not to investigate everything, but to investigate wisely. Even when investigations appear normal, persistent fatigue should never be dismissed. Sometimes the diagnosis lies in recognizing the patient's symptom patterns, understanding the patient's overall health, and looking beyond the lab values. Clinical judgment remains one of the most important diagnostic tools. And so, fatigue is a symptom, it's not a diagnosis. And right investigation can help identify the cause, but they should always be guided by a careful medical evaluation because good medicine isn't about ordering more tests, it's about asking the right questions and choosing the right investigations. Thank you.